to Childbirth. I'm Ella Ogden.
I'm Libby. I'm Alex.
Labor is divided into 3 stages. The first stage lasts about 10 to 20 hours for first-time mothers, and it's divided into early and active labor. This is when contractions start and the cervix begins to dilate, preparing for birth. It is considered active labor once the cervix has dilated to 4 centimeters and contractions get longer, stronger, and more frequent. Once they are about a minute long and 5 minutes apart, this is when new mothers should head to the hospital. Transition is the hardest but shortest stage of labor. This is when the cervix has dilated to 7 centimeters and the contractions have little to no break in between. The second stage of labor is pushing. This varies majorly from woman to woman. It could last from minutes to hours. This is when the cervix is dilated to 10 centimeters. And in the ideal birth, at the end of pushing, the baby's head will emerge first before the rest of the body so that the airways can be cleared before they put babies on mother's chest, where they'll either keep the umbilical cord attached for an hour or cut immediately after birth. And the final third stage of labor, which is not as well known, is delivering the placenta. This is pretty quick and only lasts about 5 to 10 minutes, and after this, blood vessels are closed to prevent further clotting.
There are many different assessments for assessing newborns. The Dubois assessment is especially useful for those who may be prone to having disabilities. The assessment is administered 2/3 away between one feed and the next. This assures that the baby is quiet and asleep, but not too deeply asleep so that they can perform the tests. The assessment uses different measures to assess the neurodevelopment of the infant. They assess posture and tone, the tone of the limbs, arm recoil, arm traction, leg recoil, leg traction, head control, and head lag. For each measure, 5 diagrams are associated with it, and the doctor administering the test would circle the diagram that most closely matches what position the baby is in for that test. The next type of test is the Brazelton assessment. The Brazelton assessment is a neurobehavioral assessment scale, and it is based on the assumption that the newborn is competent and completely organized. The Brazelton assessment assesses behavior repertoire with 28 behavioral items, which is scored on a 9-point scale, and assesses neurological status on 20 items, which is on a 4-point scale. The Brazelton assessment is used to examine the effects of prematurity, low birth weight, undernutrition, and a range of pre- and perinatal risk factors. It also can examine the effects of prenatal substance exposure, environmental toxins, temperament, neonatal behavior in different cultures, prediction studies, and studies of primate behavior.
Another more commonly used option for newborns is APGAR scores. These APGAR scores are taken at 1 minute and 5 minutes, and babies are placed on a scale of 1 to 10 based on how well they're doing in 5 different areas: their color, heart rate, reflexes, muscle tone, and respirations. If a baby is born prematurely or by emergency C-section, they may have lower scores, and these tests will need to be repeated every 5 to 7 minutes until their numbers get higher or a treatment plan is decided on. Extremely low scoring babies in respirations may get oxygen masks or simply just need to be stimulated with a towel to get their lungs going. For low heartbeats, fluids or medication may be administered through blood vessels in the umbilical cord. But if the baby's numbers don't go up after that, there may be reason to believe that there's a bigger issue here. So while these tests can't be the sole factor for diagnosis, they can give us indicators for things such as cerebral palsy. But these scores can also be affected by maternal sedation, gestational age, or trauma that happened at birth. So you really just have to investigate deeper and find out what the meaning is for the low scores. But most babies recover between that 1 and 5 minute mark, and there is no other treatment needed.
There are many different options for childbirth depending on the circumstances and preferences of the mother. So one method is going to the hospital, where nurses and doctors will help with the process of vaginal delivery or natural birth. The hospital also gives the option of C-sections, which would be done in the case of an emergency or other health-related problems. Another option for delivery is home birth, which is usually done based on low risk and with the help of trained or nurse midwives that help with the delivery process. Doula is also an option where a trained individual helps provide comfort and support to their client before, during, and after childbirth in order for them to have a healthy and enriching experience. Most women's childbirth choices depend on their situation, factors, and other medical issues. It would be important for women to look and ask what one would be the best to achieve a successful pregnancy. So, different physical, emotional, and psychological adjustments need to be made to have an infant caregiving bonding. An example of a physical would be regulating the newborn's temperature. This can be done by the parents performing skin-to-skin contact with their baby and swaddling. An example of emotion would be the parent's response to a newborn crying. Parents need to have positive interactions and fast, responsive care for their child instead of just letting it go. Lastly, an example of physiological would be understanding the baby's cues, like when they are tired or hungry and they start to cry.
Thank you for watching. Our references and poster are attached in a separate document.
I hope you learned all about childbirth.
Thank you.